Hi Blake, my name is Josh. I'm a family nurse practitioner student from Saginaw Valley State University. My hands are washed. How are you doing today?
Not too bad. How are you?
Not too bad. So if I understand correctly, the purpose of this visit is kind of for a general checkup, correct?
Correct.
Okay. Have you been having any issues lately, any pain, anything abnormal?
Nope.
Okay. Then what we're gonna do first is I'm gonna test your vision. I do have a Snellen eye chart hanging on the wall over there, and if you stand right about here, that'll be 20 feet away. Do you have any issues with your eyes?
I do have astigmatism. I wore glasses as a child. They gave me very bad headaches. So once I passed my driving test without them, I have not worn them since.
Okay. And no like contact lenses, glasses, anything?
Not regularly.
No surgical procedures?
Nope.
Okay, thank you for that information. So then I will kind of angle this computer a little differently to capture the Snellen eye chart on the wall right there. And then while he's walking to that, I'm going to observe kind of his general gait, how he walks. Doesn't appear as if he has a limp or any shifting of his pelvis. So then what I'm going to have you do is I'm going to have you cover your left eye first and read down as far as you can.
EFPTOZ,
All right, and as far down as you can go?
Yep.
Okay, so right eye would be 20/30 vision. So now if you have left eye.
EFPTOZ, that's as far as I can go.
And then 20/70 on the left eye. Not sure if I think I might have said left eye for the first one. 20/30 for the right eye, 20/70 for the left eye. So now I'll have you do both eyes simultaneously.
So EFPTOZ, LPED, PECFD, EDFCZP.
Okay, and then 20/30 for both eyes simultaneously. Can you tell me what color this is?
That is gray.
And then how about this?
That is a darker shade of gray.
Correct. So you can't differentiate between colors. Normally those would be kind of a red and a green, but I did not have any color ink in my printer. So I will have you return back to your seat over here now. And I'm going to hand you a Rosenbaum chart. We're going to hold this about 14 inches away from your face. And then you're going to, you can do both eyes at the same time for this one.
ETL, NPD, CFTZ, LOPDE, NTFLCZ, FEZPDT, ECTPNL.
Okay, very good. 20/20 for the Rosenbaum chart. Now what I'm going to do is I'm going to kind of note the generalness of your eyes. I'm going to be looking for symmetry. I'm going to be inspecting structures of the eyes. I'm going to kind of, I don't have gloves, but I have you pull down your lower lid so I can inspect your conjunctiva on each side. Very good. Okay, conjunctiva is pink, it's not erythematous. I'm not noting any drainage. Bilaterally, his sclera is white. His iris, he does have blue eyes. Not noting any opacities of his lenses. All right. So now what we're going to do, Blake, is I'm going to have you just kind of look straight ahead. I'm going to test both consensual and direct pupillary reaction. So what I'm going to do first is I'm going to do consensual. I'm going to shine a light in the left eye and then observe the right pupillary reaction. Okay. And starting off, I'd say we're about a 4 millimeter. Then the consensual reaction, both eyes do progress to a 2 millimeter bilaterally. Now I will do the right eye and go to the left eye for observation. And I would say the same there. 4 millimeter starting off, proceeding to a 2 millimeter. Now we're going to do a direct visualization. Okay, now the left eye. Very good, and then direct visualization. Once again, about a 4 millimeter going to a 2 millimeter. One test that I will not perform, but I will verbalize, is testing conjugate gaze. Now what I'm going to do, Blake, is I'm going to test your extraocular eye movements. These are going to test cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, cranial nerve number 6, abducens. And I'm just going to be moving my pen light in an H essentially. I can use my finger too. And keep your head still and follow my pen with your eyes. Okay, now I'm going to test convergence and accommodation. Convergence, I'm going to have you focus in on my pen as it comes to your nose. Now look at the wall directly that way. Very good. Convergence and accommodation are both present. So now what I'm going to do is I'm going to pull out my ophthalmoscope and I'm going to use my right hand for his right eye, left hand for his left eye. First, I'm going to note the red reflex, then I'm going to note the vessels of the eye, artery, veins, and then I'm going to note the physiologic cup as well. A little bit of an angle. And I'm noting the red reflex in the right eye. I'm going to put my hand on you here, Blake, just so I don't hit you in the head. Okay. And I'm visualizing the arteries and the veins. I do see those. I don't see any papilledema. And I'm visualizing physiologic cups. Now I'm going to switch sides here real quick. I'm visualizing the red reflex on this side. And then I am seeing the physiologic cup as well here. Arteries and veins, and no papilledema in this eye either. Okay. Now what we're going to do, Blake, is I'm going to inspect your face and your skull. I'm going to kind of palpate lightly. Is there any pain as I do this?
Nope.
Okay, I'm palpating face and skull for symmetry, facial symmetry, and not noting any drooping or anything. Everything appears to be moving symmetrically as I'm talking to Blake. And I'm just kind of looking at his hair, and I'm going to kind of go behind you too, Blake. He does have a full head of hair. I'm not noting any balding. His hair does appear to be thick in consistency, does have longer hair. So now what I'm going to do is I have a little Q-tip here, Blake, and I'm going to look through your head. I'll have you lean back just a little bit. Maybe separating in a few locations, just noting if there's any scaling, dandruff, lesions, any infestation, and I'm not seeing any of that present. Okay, so now what I'm going to do is we're going to test a couple of different zones on your face, 3 branches essentially, and this is going to test your trigeminal nerve. There is a sensory portion as well as a motor portion, and this is what it's going to feel like, just kind of a gentle touch in each zone. So I'll have you close your eyes, and if you feel a little kind of wisp, a little gentle touch just like that, I want you to let me know.
Touch. 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 Touch.
Okay, so the forehead location would be the ophthalmic zone, kind of just right lower cheek here as I'm touching would be the maxillary, and then the lower one would be the mandibular. Now I'm going to have you clench your jaw. Okay, and that tests the motor portion of it. Now what I'm going to have you do is puff your cheeks out, smile, raise your eyebrows, frown. Okay, and that tests cranial nerve number 7, facial. Now what I'm going to do is I'm going to palpate your frontal sinuses as well as your maxillary sinuses, and I'm going to percuss those. Frontal. Any pain?
Nope.
Okay. Any pain when I do that?
Nope.
Maxillary. Any pain?
Nope.
Any pain with either of that, please? Okay. So now what I'm going to have you do is tip your head back just a little bit. I'm going to inspect your nares. Just looking to see if there's any drainage, if the septum is intact, if the septum is midline, if there's any nasal polyps. So now I'm going to a test for patency. We're going to test olfactory cranial nerve number 1 here. I'm going to have you occlude each nostril, and I just want to make sure you can breathe out of it. Okay, any issue with that? All right, now I'm going to have you close your eyes, and I'm going to give you something to smell, and I want you to tell me what it is.
That is a white 0-calorie monster.
Okay, very good. Cranial nerve 1 olfactory is intact. So now I'm going to proceed to the ear portion. Have you ever had any issues with your ears, Blake?
Nope.
Any surgical procedures, any hearing loss that you've noted?
No.
Okay, very good.
When I was in elementary school, I put a pencil lead in my ear. Does that count?
Did you cause any trauma with that, I
I don't
suppose?
think so. I went to the ER and they got it out.
Okay. So I'm going to kind of provide a distraction for your ears here. I'm going to be essentially kind of pressing in rapidly on your tragus, and then I'm going to be behind you while I'm doing this, and I'm going to whisper a number, and then in the opposite ear, I want you to tell me what that number is, okay?
Yep.
So we'll do your right ear first.
99.
Very good.
174.
Very good. So that tests cranial nerve number 8, vestibulocochlear. So now we're going to do a couple of special tests with our tuning fork here. I'm going to do the Lieber test first, which is essentially, I'm going to strike this fork lightly, and I'm going to put it right in the center of your head here. And this is testing for lateralization. We want to make sure that the sensation is equal on either side. And does that appear equal?
Yes.
Very good. So now we're going to do the Rene test, which tests air conduction versus bone conduction, and we do want air conduction to be greater than bone conduction. So I'm going to strike this once again. I'm going to put it on your mastoid bone here. And I want you to let me know when you don't hear it, and kind of how loud it is. And then I'm going to flip it around to your ear here, and I want you to let me know if it's louder, and then when you stop hearing it, okay?
Yep.
So we'll do your right ear first.
No longer here.
Okay. And you can hear it now?
Yep. And can no longer hear it.
Okay. For the bone conduction, for the right ear, the sound disappeared in about 5 seconds, and I counted 11 seconds for the air conduction. So that is what we would like for that test.
It's gone. And it's gone.
Okay, once again on the left ear, about 11 seconds for the air conduction. Bone conduction was a little quicker. That one was about 3 seconds. Now each side bilaterally, I'm going to do each ear. Any pain when I do this?
Nope.
Any pain when I do this?
Nope.
So when I pull up and back on the auricle, that's going to test for an otitis externa. Pressing on the mastoid bone here, any pain?
Nope.
Pressing on the mastoid would check for an otitis media. Any pain?
Nope.
Okay. Pain?
Nope.
Okay. Now with my otoscope, I'm going to assess your tympanic membranes as I go in. We're going to be looking for the amount of cerumen, if there is any drainage, any erythema. Tympanic membrane is pearly gray and intact. Not noting a large amount of cerumen in the inner ear or the ear canal. And the location, the cone of light for the right ear should be in approximately the 5 o'clock position. And the left ear, the cone of light should be in approximately the 7 o'clock position. Okay, same for that ear, the left ear. Not noting a large amount of cerumen in the ear canal. Cone of light is in the 7 o'clock position. So now proceeding from the ears blade, I'm going to go to your mouth, just kind of inspecting your lips. I'll get my pen light back out right here. I'll have you open your mouth, just kind of inspect your gums, the oral mucosa. I'm not noting any erythema. Looks like you might chew on your cheeks a little bit. I'll have you say ah. Okay, and saying ah tests our vagal nerve, cranial nerve number 10. Proceeding on from that, cranial nerve number 9, glossopharyngeal, I'm not going to test, but that would be the gag reflex. Okay. So now, Blake, we're going to kind of proceed back to, well, I already looked in your mouth, as I mentioned. Inspected your hard palate is intact. Looks like your tonsils are intact as well. Could you stick your tongue out at me, side to side? Okay, and that's hypoglossal cranial nerve number 12. So now we're going to proceed down to the neck portion. Kind of inspecting your neck here. It appears that your trachea is midline. And we're going to test spinal accessory nerve, cranial nerve number 11. I'm going to put some light pressure on the side of your face, and I want you to turn your head against it. Okay. All right, now shrug your shoulders. Very good. Okay. And then now I'm going to palpate the thyroid gland. First, I would find the thyroid cartilage and then count 2 tracheal rings below that, and then that would be the isthmus of the thyroid gland. And then I'll palpate off to either side of that for any enlargement or any pain. And I'm going to be behind you while I do this one, buddy. Take your head back a little bit. Any pain or discomfort?
Nope.
Okay. Now I'm going to palpate your lymph nodes. We're going to do the preauricular, postauricular, occipital, parotid, submandibular, submental, and we'll do the posterior cervical chain, the anterior cervical chain. Now have you shrug your shoulders and your supraclavicular nodes. Okay. Was there any pain at any point while I was palpating any of those?
Nope.
Okay, so I'm going to keep you sitting here for a second, just kind of inspecting the front of your chest. Everything appears to be moving symmetrically. Do you ever have any issues breathing or anything?
Nope.
Okay, so what I'm going to, I'll actually have you move Hawk for a second now.
I will try.
And we're going to palpate for fremitus. Then we're going to percuss the front of your chest, and then I'm going to auscultate the front of your chest as well. And then just kind of, once again, general appearance. You don't appear to be in any distress. Counting, your respiratory rate, I would say, is approximately 17. Your work of breathing is non-labored. So there are 6 locations to palpate for fremitus on the front of the chest. And I'm going to use the balls of my hands. And I have you say 99.
99.
99.
99.
99.
99. 99.
99.
99. 99.
Okay. And I'm palpating equal vibration on either side for that. So now we're going to percuss 6 locations as well. I would use my distal interphalangeal joint on the left hand, and then the middle finger, and then I would use the middle finger on my right hand to actually percuss. I'm going to use the diaphragm of my stethoscope and auscultate those 6 locations as well. Each time you feel me place the stethoscope back on your chest, I'll have you take a deep breath, okay? Okay. And I did not note any adventitious lung sounds. His lungs are clear. Have you had any issues breathing lately, Blake?
Nope.
Okay. So now I'm going to proceed to the posterior portion of your chest, and we're going to essentially do the same assessment. I'm going to have you say 99 again. Only on the back, there are 7 locations to palpate for fragments, as well as percussion, as well as for auscultation. So what I'm going to have you do, Blake, is best we can, I'm going to try to angle this a little differently, just so we can get a little more of your back to the camera here. Okay. Say 99.
99. 99. 99. 99. 99. 99. 99.
Okay, very good. Now I'm noting equal vibration on either side. And then while I'm here, I'm going to kind of inspect anterior-posterior ratio. And it does appear to be a 2-to-1. No barrel test present. Now percussion. Okay. I'm not noting any hyperresonance, anything that would indicate hyperinflation of the lung. And lying back here as well, Blake, I'm just going to note that your spine is midline. Any pain on your spine as I palpate?
Nope.
Okay. And then I'm going to test costovertebral angle tenderness as well, lying back here, okay? Any pain when I do that?
Nope.
Okay, now I'll have you kind of sit back around to our original sitting position.
Excuse me, Hawk.
Now we're going to proceed towards more of the cardiovascular assessment. I'm going to auscultate carotids individually, just for the presence of a bruit, using the bell of my stethoscope. While I'm doing this, Blake, I'll have you hold your breath for about 5 seconds, okay? Okay, very good. No bruit on the right. And no bruit on the left. Now I'm going to palpate our arteries. I'm going to do the carotids individually. Okay, that's about 2+, I would say. And 2+ on the left as well. I'm not going to put your arms out like that, Blake. I'm going to palpate the brachial arteries simultaneously. Those are 2+ as well. Now the radial arteries. 2+. Now I'm going to go down to posterior tibial. Just going to go and get there. Those are a little fainter. I'd say those are 1+. Now our dorsalis pubis, pedal pulses. Those ones are a little stronger. I would say those are 2+ as well. Okay. So now, Blake, what I'm going to have you do is I'm going to have you kind of lay down in a supine position on your back, okay? And at this time, I don't have any tangential lighting. but I would, I'll move you for a second, I would be kind of use that to help find the point of maximal impulse, which would be about mid-clavicular line at the fifth intercostal space on the left. So what I'm going to do now is I'm going to palpate for any lifts or heaves using the pads of my fingers on the chest. And then the ball of my hand to palpate for any thrills. Okay, well, I have you here, Blake. I'm going to listen to your heart, 5 locations, aortic, pulmonic, Erb's point, tricuspid, and then as well as our mitral. And I'm going to use the bell and listen to Erb's point, tricuspid, and mitral for the presence of any bruits. And then one at the fifth intercostal space on the left. I'm just going to note his apical pulse. And I would listen to this for a minute. But for the purposes of this video, I did approximately 30 seconds. Apical pulse is regular, strong, I'd say at a rate of approximately 98. Now I'm going to palpate again, Blake, for the point of maximal impulse. Okay, and you do have a fairly strong point of maximal impulse. Just a little lateral to the midclavicular line just below the breast on the left, approximately a 1 inch by 1 inch location for his PMI. Okay, Blake, while you're laying flat, you keep your legs like that. Have you ever had any issues with your stomach?
I have a sports hernia, but other than that, no.
Okay. So I'll have you lift your shirt up just a little bit. And once again, tangential lighting would come in use here. I'll look to see if there's any visible hernias that I can see, any pulsations, any edema, any prominence of veins, which I'm not seeing at this time. I'm not seeing anything abnormal. So now I'm going to use the bell, and I'm going to listen to our arteries, aorta, our renal, iliac, and then our femorals. I'm going to straighten your exhale just a little bit. Okay, I'm not noting the presence of any bruits as I listen to those arteries. So now what I'm going to do is I'm going to flip my stethoscope back around to the diaphragm, listen in all 4 quadrants. And I would listen to each quadrant for approximately a minute. For time purposes on this video, I did not listen to it for a minute, but I did note his bell sounds to be active. So now we're going to proceed to percussion. When I'm percussing the liver border, I'm going to put my stethoscope back around my ears just to perform the scratch test as well. Then I'm going to note the gastric air bubble as I'm over it. And then suprapubic dullness. Now the liver border. Okay. I have my liver border, so I'm just going to do the scratch test. I'm going to put my stethoscope just below the xiphoid process, and then as I kind of drag my fingers along where the liver border would be, sound should transmit a little bit faster. Okay. Now I'm going to proceed to palpation, just like palpation, Blake. Noting any abnormal masses, nodules. Okay, and once again, I already have palpated for the liver border, percussed for the liver border. Okay, now Blake, I'm going to have you kind of roll onto your right side, and I'm going to percuss along the approximately mid-clavicular line on the left, ribs 6 through 10 for the spleen. And you lift that arm up. Okay, now you lay back on your back, supine. Okay, now I'm going to proceed to deep palpation. I'm going to have you take a deep breath, and then when you exhale, I just want to press a little bit deeply. Okay, so I'm going to test for Murphy's sign, which would indicate a cholecystitis. I'm going to once again put my fingers around the liver border, have Blake take a deep breath, and then when he exhales, I'm going to perform deep palpation. If it interrupts his exhale, then that could indicate a cholecystitis. Okay, and that did not interrupt his exhale. Now I'm going to do McBurney's point, which is going to be kind of a diagonal line between the anterior superior iliac spine and his umbilicus palpation, which could indicate an appendicitis, approximately here. Any pain?
Nope.
Okay, so now I'll do Bloomberg sign, which would be kind of deferred pain. I'm going to palpate in the left lower quadrant, and then pain would appear in the right lower quadrant if there was a positive Bloomberg sign. Any pain?
Nope.
Okay, very good. So those signs would both be negative. So now, Blake, what I'm going to have you do is I'm going to have you kind of scoot down just a little bit more, and we're going to test for Brodzinski's sign and Koenig's sign, which would indicate meningeal irritation. Okay, so we'll do Brodzinski's first. You have to lay it nice and flat. Now I'm going to grab your head. I'm going to flex it up. Any pain?
Nope.
All right, and he is able to do that. His legs are not bending, so that is normal finding. Now we're going to do Koenig's sign. I'm going to kind of bend your leg up here. And any pain?
Nope.
No pain with that, so that is a normal finding as well. So what I'm going to have you do now, Blake, is I'm going to have you stand back up. And now I'm just going to kind of visualize your extremities, making sure everything's symmetrical, everything moves symmetrical. Have you ever noted any strength on any one side or anything?
Nope.
Okay. And then I'm looking at your skin, just kind of visualizing over bones, joints. I'm going to take tendons. I'm not seeing any bruising on you. Do you have falls or anything?
Nope.
Okay. And there doesn't appear to be any skin breakdown over the bones, joints, tendons, ligaments. And then just comparing bilateral muscle size, everything appears symmetrical bilaterally. Palpating quadriceps, calves. Okay, and then any pain when I was palpating that?
Nope.
Okay, so I'm going to kind of tilt this back a little bit now, and I'm going to have you perform the movements that I perform. We're going to test the range of motion of your head. I'm going to have you look left and right, up and down. Now put your ear down to your shoulder. And then opposite ear. Very good. Any issue with that?
Nope.
Now, okay, we're going to do your shoulders range of motion. I'm going to have you flex, put your arms up in the air, extend, put your arms behind you. I'm going to have you adduct, put your arm across your chest. Now the opposite arm. And then I'm going to have you abduct. I'm going to have you bring your arms up to your side. Now lower them down slowly. Very good. Now we're going to do internal rotation. I'm going to have you reach behind with your arms and try to grab your shoulder blades. Now I'm going to have you put your arms up at your sides like this for external rotation, and we're going to flip them up. Okay, any pain or difficulty with those movements?
Nope.
Okay, so now I'm going to have you lay back down on your supine position. I'm going to test the range of motion of your hip, your knees. I'm going to do a couple tests to take a look at your MCLs, LCL, ACL, PCL, and then your ankles. Okay, so we're going to do hip first. I'm going to have you bring your knee up all the way to your chest with the right, then the left. Okay, now bring it back down. So that could test both flexion and extension. So now we're going to do adduction. I'm going to have you bring your right leg across your body the best you can. Now your left leg. Now abduction, I'm going to have you bring your right leg out, and then your left leg out the best you can. Okay, now we're going to do internal and external rotation. I'm going to kind of show you the movements I'm looking for, and I'm going to have you do them. This will be internal rotation, and then external rotation, and I'll have you do that with each leg on your own. Okay, now I'm going to do a test that's going to check the patency of your MCL. This one is called the valgus maneuver. So I'm going to grasp here, and then I'm going to put my thumb kind of in the joint space here, and I'm going to put kind of an external pressure to see if I can palpate any separation. And I am not, this side would be a little bit more of a different position, but with the couch here, it's kind of difficult. So it's kind of that outward stress. I'm not noting any separation there either. So that's your MCL. LCL, we're going to do the Vargas maneuver. So I'm going to have my thumb on the outside here, see if I can palpate any separation joint space. And I'm not getting any separation there. Okay, I'm going to have you bend up at your knees. I'm going to do an anterior drawer test, which would test your ACL. Posterior drawer, which would test your PCL. Do anterior drawer first, see if I can pull forward. Posterior drawer, see if I can push back. I'm not able to. Joint is not loose, it is intact. Forward on the left, push back. And I'm not able to move that joint around as well. I'm going to have you put your legs back out straight. Pull them up towards your nose, dorsiflexion. Push down, plantar flexion. Okay, very good there. Now I'm going to have you sit back up.
Excuse me, Ron.
And I do want to test your grip strength quick before we go back to your muscles. Big squeeze. All right, strength is equal bilaterally. Okay, so now I want to test your deltoid strength, your latissimus dorsi. I'm going to have you put your arms out in front of you. I'm going to press down. Now I want you to put resistance, testing your delt. Now I want you to press down, testing your lat. And we grade this strength on a scale of 0 to 5, with 5 being normal strength. That was normal strength, I would say. Now I'm going to have you put your arms out like that, flex them towards you, testing your bicep. Now press out, extend, testing your tricep. Okay, and I would say that is a 5 as well. So now what I'm going to do, Blake, is I'm going to test your hip strength, kind of your glute, and your psoas muscle. I'm going to press in on your knees, and I want you to put an external force.
Okay.
Now the opposite. All right, I would rate that as a 5 as well. Now we're going to do kind of plantar flexion, dorsiflexion on the feet again. Pull up towards your nose. Now press down. Okay, and then I would grade that as a 5 as well. Now we're going to proceed to your deep tendon reflexes. I'm going to get my reflex hammer here. Okay, so we'll do your triceps first. I'm just going to kind of have you hang your arm, kind of hang on if you can. Okay, so normal reflex would be a 2 plus. Anything more than that would be considered a clonus or hyperclonus. Okay, so now we're going to do brachial. Okay. Now brachial radialis. And then brachial radialis on the left. All right, now best we can in this position, we'll do patellar. Okay, definitely 2 plus in the patellar region. Uppers, I'd say maybe a 1 plus. Now we'll do the ankle jerk, best we can where I'm assessing on your Achilles. Okay, I would say those are 2 plus as well. Right. So then what I'm going to have you do now, Blake, before I have you stand up, I'm just going to try to position this a little better. Test the Babinski reflex, see if it's intact, if you have one. Okay, not one on the right. And there's not one on the left either. So now I'm going to have you stand back up. And we're going to test cerebellar function. I'm going to have you put your arms like that. Rotate them, your hands rapidly, best you can. Now touch your finger to your thumb, kind of like that kind of motion. Okay, and then best you can standing is I'll show you what to do. I want you to take your leg or your heel and run it up and down your shin. And the opposite leg. Okay, that is a nice controlled coordination. So I kind of assessed your gait earlier, but now we can do a couple different assessments for your gait. I'm just going to have you walk normally. Now I'm going to have you walk back from the heel to toe, doing a tandem walk. Now I'm going to have you walk back, kind of in a plantar flexion, and then assessing your balance. And now back on the heels of your foot in that dorsiflex position. Okay, and then the last thing that I have for you is we're going to do the Romberg test. I'm going to have you close your eyes, put your arms out at your side. Going to assess for any swaying. And do this for approximately 20 seconds. Okay, you can open your eyes. Negative Romberg test. There was not any swaying that I noted. And that will actually conclude our assessment, Blake. Do you have any questions for me?
I do not.
All right, thank you very much for your time.